Well, thanks everyone for joining us today. My name is Aaron Conley. I'm a research fellow in Southeast Asian political change and foreign policy here at the IISS in Singapore. We're here to talk about the politics and economics of Indonesia's response to COVID-19. Out of all the Southeast Asian countries, Indonesia has been hit hardest by the virus. We don't know exactly how many cases there have been in Indonesia because we have a government that hasn't done a lot of testing and has been reluctant to release key information. But there's a likelihood that there are around 8,000, close to 8,000 deaths from COVID-19 when you put together the official statistics and some of the other statistics. And so we thought we would convene this webinar to go over some of the epidemiological, political, and economic factors behind the pandemic and the consequences of the pandemic. I should mention that although this seminar series, which we used to run in our office in Singapore, traditionally has been not for attribution. We've moved it online along with the times, and we've moved it on the record, and the recording will be available if you want to go back and refer to it after the fact. Let me just briefly introduce our speakers. You have their bios in your email, so they don't need too much more introduction. But we have first Elina Ciptadi from Kawal COVID-19, which is really a sort of extraordinary organization that in just a matter of weeks became the primary source and the most reliable source for information on the spread of the pandemic in Indonesia, along with her co-founders, who really she describes as data junkies and have become a real resource for Indonesians trying to figure out what's going on with the virus. We have Dr. Evan Laksmana from CSIS, the Center for Strategic and International Studies in Jakarta, who I think is one of the really the top academic expert on civil military relations in Indonesia and the military's role in Indonesian society today. And then finally, my former Lowy Institute colleague, Roland Rajah, who's the lead economist and director of the International Economy Program there, to speak about some of the economic consequences and factors when it comes to this pandemic. We'll talk for about 25-30 minutes amongst us, and then we'll open the floor up to questions. If you do have a question, you'll notice that there is a question and answer box at the bottom of the screen. We're going to keep that open and visible to everyone throughout this conversation. You should feel free to put a question in there, but what I'd ask you to do is, because I'm going to call on people who put questions in that box, please keep your questions very brief, only 3-4 lines at most. And then I will call on you, we'll unmute your mic and you can ask your question. When we do that, keep your question to a question, not a statement, and keep it, let's say, less than 30 seconds to a minute. We do want there to be some interaction, some two-way dialogue, but we want to give our speakers a chance to cover as much ground as possible. So with that, I just want to turn to you, Elina, and maybe cover some of the basics of what has happened with COVID-19 in Indonesia. And maybe you can, we're already beginning to start to talk about reopening in Indonesia, and there are concerns that that's premature. But can you talk to us a little bit about, take us back to the beginning and talk to us a little bit about how the government responded in the early days of the pandemic?
Okay, good afternoon, everyone in my part of the world, and good morning if you are in Europe time zone. As Aaron just mentioned, parts of Indonesia are gearing up for reopening. And some people are probably wondering if it makes sense to jump on board the new normal promoted by the government. But I want to start the discussion today by putting 3 things on the table. First, going back to the beginning, the government's narrative from the very beginning has been one that denied the science and denied the need for early intervention. So back in February, instead of educating the people about the risk of COVID-19 and what can they do to prevent getting infected or from infecting other people, the narrative that we hear a lot is that we're protected by prayers, we're protected by tropical climate, herbal drinks, it's just flu. And every death out there is caused by other illnesses. COVID-19 itself didn't kill. 91% recovered on its own. And then as time went along, there was a lot of pushback against the policy of lockdown. Lockdown became a highly politicized term. So for example, we heard a lot in Indonesia how Italy went on lockdown, and then their number of cases went up exponentially. So lockdown didn't work. So there's chaos in India because of the lockdown. Meanwhile, Vietnam and Taiwan didn't go into full lockdown, and they managed to contain the virus. So the narrative was very simplistic in a way that failed to mention the complexity and the nuance that went into, for example, the policy of Vietnam and Taiwan, that they did the drastic measure kind of very early in the game. So they didn't mention that. What they mentioned was that lockdown, no lockdown, very simplistic polarization of the term. So instead of taking lessons from countries that have been impacted earlier than Indonesia, what the government has chosen to do is nitpicking surface level information to fit its narrative that Indonesia is not doing too badly. So, and it is this very attitude of science denial and downplaying that urged us, and we're a group of data junkies, to launch kawalcovid19.id back on March the 1st. This was almost 3 weeks before the government actually opened a centralized portal of information for anything COVID-19. So at that time, even back in February, we felt the urgency to tell people what's accurate about COVID-19, how it spread, how to mitigate the risk, because at that time, the government hasn't done much in the way of educating Indonesians or preparing them for the eventuality of Indonesians being hit by it. The thing about pandemic is that it starts with a P, and the way we call it is that, P means passport. So when a disease has a passport, it's a pandemic. So, and when it's a pandemic, everyone will be affected, including Indonesia. So in February, they did little to fight misinformation, and in quite some instances, we would say that they are the source of false information. So that's the first, denying the science and denying the need for early intervention. And the second is data. Collecting data has been a monstrous task for us. And all of us at Kawal COVID-19, we're doing this on top of our day job. This is something that we would do anyway, even if nobody asked us to do it, just because we're interested in seeing how the data in Indonesia is different from any other countries, or in which ways is it consistent with the global trend. Now, the official data is announced every afternoon by the Ministry of Health. And what the public sees, so the data that we have access to, is what the National Task Force, or in Indonesia, they call it Gugas COVID. So what we see is also what the task force sees. So only the Ministry of Health knows the real data, and they're not even sharing it with their peers, to the best of our understanding. And in many instances, the data that they publish publicly doesn't include, among others, onset of symptoms, the date of testing. So we don't know how much delay occurred between someone showing symptoms until they're tested, until they're properly quarantined, until they're declared as a positive case. So so in a few hours, we will see the Minister of Health announcing the number for the day. So what we don't know is that, the number of positive cases from the day, when were they tested? We don't know. When did they start showing symptoms? We don't know. How many of them are the result of contact tracing versus they're showing symptoms first? We don't know. And for many of the patients, there's no comorbidity data and their demographics. This data is needed for those who want to jump at the opportunity of researching Indonesia-specific COVID cases. And they simply don't have this data. So, in the absence of a full set of data at national level, we turn into provincial and city level websites for data. And we discovered that the data collection method is not even uniform. There's still no single data collection point for COVID-19 as of today. And when we speak to different provincial or city authorities about the data, some of them don't even seem to know what data to collect in a way that helps them respond in the most effective way. So, so this is why, even though we have statisticians, we have data analysts, we have math guys, we have epidemiologists, public health experts on our team, you don't see us releasing, for example, an epidemic curve, because there's no complete set of data to predict when is this going to end reliably. So what we instead attempt to do is now a scoring system for local governments to see how big is the risk of COVID-19 spreading unknowingly in their area. So we're still finalizing the details of that, and we should be able to announce this by the end of the week. But by the end of this week, we will have metrics, we will have a scoring system that basically kind of rate the risk from city to city or province to province. So that's the second thing, problem with data. And the third is the government seems to dichotomize economy and health, constantly putting economy first. And that's why we hear a lot about reopening and jumpstarting the economy without so much time allocated on risk communication, about communicating the risk that still remains in the community. So what we've been hearing a lot is that lockdown will hurt the economy. The curve must come down in May so economic activities could resume. And then the curve didn't come down, but we must jumpstart the economy nonetheless. And so this is where we are today. Some parts of Indonesia are starting to reopen when daily number of cases in the last several days have been higher than ever. The curve doesn't seem to be leveling off. And if it does, we need to ask the question, is it really leveling, or are we just not testing or tracing enough people? So our testing rate is still among the lowest in the world. Our tracing rate is low, prolonging the risk of exposure for people who are starting to go to work. And this economy first narrative is going out despite overwhelming wish for the government to put health first. The government did a poll, the same poll that they recently announced to say that kind of the majority of Indonesians believe that the National Task Force for COVID is doing a good job. I think they say that the number is something like 67%. That same research actually pointed that regardless of demographics, people want the government to put health first. So the National Development Agency has come up with 15 criteria for reopening, and it's quite similar to WHO requirements. But what we've seen is that cities and provinces that have not met those criteria are allowed to start reopening anyway. And in this case, we see that Indonesia is fairly similar to the US. So if you ask me, is Indonesia ready for a new normal? The answer is that even the official data does not suggest so. So we don't see economy and health as mutually exclusive. We cannot expect tourism to bounce back when people are afraid to come. We cannot expect factories to run at full speed and contributing to the economy when they don't have the assurance that workers don't pose infection risk to others. So there's no economic recovery without health. And what we are going to see is that places and countries that handle this crisis well will have economic competitive advantage. And I'm going to leave it at that. Thanks, Aaron.
Elina, can I just ask you for a little bit of clarity on one issue? One of the really innovative things that Kawal COVID-19 has done is when the government refused to release data about people who had been dying with COVID-19 symptoms, you all went to the provinces and to hospitals and got that data, or at least a large part of that data, because it wasn't available for some provinces. That seems to me to be the best estimate of how many people have died of COVID-19 in Indonesia, and it aligns with World Health Organization guidelines for determining deaths. So how many people does the government say does the central government say have died from COVID-19 at present, and how many people do you all believe have died at least from COVID-19 symptoms?
The official data is slightly over 2,000 people. If I'm not mistaken, it's 2,300 as of yesterday. While there's like over 5,000 people have died with COVID-like symptoms, as what Indonesians call it, PDP, clinically diagnosed. So if we are using the WHO definition of death by COVID, Indonesia is talking about close to 8,000 deaths today.
And why do you think the government's reluctant to use the WHO definition? Have they given you any insight as to why they continue to use?
We don't know. But what I can say is that if we are assuming 3% fatality rate for COVID-19, and we put 8,000 as the true death number, we're probably talking about 265,000 cases in Indonesia today, instead of the 30 something. Let me just look at my number.
8,000?
Yes, 39,000. Yeah.
So that's a pretty massive undercounting. I want to go to Evan now. Evan, you've done a lot of really good work on how Indonesian military officers are trained, particularly overseas, and the sort of the culture of the TNI, the military. And the military has played a really prominent role in the government's response to the pandemic. The health minister is a military doctor, his spokesman's a military doctor, the head of the task force is a former head of the special forces. And I know you've argued that what we're seeing is a partial militarization of the government's response. Can you walk us through what you mean by that? And then also tell us, what does that mean for how the government has responded? How has it perhaps changed how they have responded, or not changed how they've responded?
Sure. Thank you, Aaron. Some preliminary discussion about the idea of militarization and the essence of the concept of militarization is basically the extent to which the military as an organization is involved in shaping the policy and implementing the policy as it relates to public health, or in this case, as it relates to COVID-19 management. This is different, however, from securitization, which is kind of the use of extraordinary measures to deal with a particular crisis. So the securitization part, in which the Indonesian government has used extraordinary measures to deal with the pandemic, I think we've covered that. When they appointed Doni Munardo to head the task force, when they changed the national budget to accommodate the potential cost of COVID-19. So they have done some of the extraordinary measures, although we can always debate whether or not those measures were actually sufficient to deal with the pandemic. As Elina said, the basic data is not even there. So trying to determine the extent to which the use of extraordinary measures and whether or not that's effective, I think that's separate from discussing the extent to which military officers are actually shaping the policy and implementing the policy. In the research that I did with my colleague at CSIS, we tried to look at the pattern both at the national level and at the local level in terms of the involvement of the military as an institution. So these would be officially sanctioned use of military personnel, of assets and all that. At the local level, the numbers where military officers are actually assigned as the deputy local task force to deal with COVID-19 is actually roughly about 30% across the provinces, the districts and the cities. So the level of institutional militarization in which the military as an organization is shaping the policy is actually not that high. But of course, this is different when we're talking at the national level, where the majority of Jokowi's cabinet key people who deals with the policy formulation process on COVID-19 are actually active duty officers or retired officers. We counted at least almost 24 of them. So we're talking about the influence of military outlook and mindset into the decision-making process, as opposed to the military as an institution being utilized to implement those policies. So what we see now in terms of the military as an institution, what we're seeing is the military is being asked to implement whatever the government decides. This goes from distribution of logistics, from providing hospitals, from evacuations, to making sure that people are abiding by the social distancing rules. So the task as it is assigned to the military as an organization is actually quite wide-ranging. Now, the issue, I think, and this goes back to what Elina was discussing at the beginning, which is to what extent ex-military officers or active duty officers have been shaping the decision-making process at the highest level. As Elina said, at the beginning, there is this denial of science, this beliefs in the climate and all that. And I think one key aspect of that in which we see some influence, I believe, of individuals who were formerly with the military or are still within the military, but their views don't represent the institution, obviously. But in terms of how they shape the pandemic management, for example, in the beginning of February and March, information, instead of being seen as a way to assure the public and increase transparency, information is seen as a secret, that you don't want to give ammunition to domestic political opposition to attack the government. So that notion of public health information as a secret, that aligns with the influence with some of the retired and active duty officers inside Jokowi's decision-making circle as far as the pandemic management is concerned. And Elina also mentioned earlier as well, the Minister of Health in particular is where some of the lackluster, if not complacent response of the beginning started. So I think when it comes to the influence of the active duty or retired officers within Jokowi's decision-making process, I think that probably wields more influence than the TNI as an institution. This has, I think, several key implications. One, I think it has to be made clear that even before COVID-19, Jokowi was already reliant on the security forces, both the military and the police, before the election, in fact, during the campaign. So the tilt of the balance in terms of civil-military relations, I think, has shifted significantly in favor of the security forces even before COVID-19. And I think as far as Jokowi is concerned, the debate, I think, is still ongoing whether or not, if this was a different president, if this was not President Jokowi, would that president be able to respond quicker and mobilize the health capacity to tackle COVID-19? I'm not so sure. I think this is a debate between structure and agency. I think the hospital health capacity, the bed to patient ratio, the doctor to patient ratio, ventilators, testing capacity, tracing capacity, those things were structural in nature. And it's been bad for 1 or 2 decades now. Jokowi didn't just happen to stumble on a bad health capacity. So whoever would have been president, I think, would have dealt with some of the challenges. The difference, I think, and I think this goes back to what Elina was saying, is the decisiveness and whether or not you listen to health experts and scientists rather than military officers or ex-retired military officers in your decision-making. And I think this is where some of the lack in our response comes to mind. Of course, I think at the end, I think the buck stops at the president. So I think the main responsibility remains at the president level, regardless of whether or not the TNI as an institution is involved, or regardless whether or not Jokowi has retired or active duty military officers as his advisors. And I think one final aspect of this militarization of the response is that this is also a test, I believe, for the strength of the norm of democratic civil and military relations. For the past 2 decades, I think the military as an institution feels that we've given up our power. We'd like to now see the civilian leadership take over and take charge. So how decisive and how successful the civilian leaders at the local and at the national government handles the COVID-19 management, I think will tell the military to what extent can they keep investing in supporting the nature of democratic civil-military relations. And this is something that I think remains an open question.
I mean, Evan, if you pull at that thread a little bit, there is the implication that if the civilian authorities underperform, and particularly if this new generation of TNI officers who are working on these provincial level task force, COVID-19 task force, with civilian authorities, with elected local leaders, if they develop a bad impression of how civilian authorities handle crises like this, what sort of lessons do you think that they would take away from that? How might that change civil-military relations in the future? And vice versa, how might it change, these politicians at the local level who are coming up, might run for national office someday, how they see the military?
Right now, I think in general, there is a sense of ambivalence within the military establishment. On the one hand, I think their key leaders have been asked to step into the breach and fill some of the, distribution of logistics, decision-making and all that. So some individuals, I think, have been seen as what's good about the military and what they can contribute to the dealing of COVID-19. But I think as an institution, they're ambivalent because they're not fully involved to take over and be in charge of every aspect of the pandemic management. But on the other hand, their leaders are required to fill some of the void. Right now, I think if we ask the local military leaders, as well as some of those at the national level, I think the trust that was built between the civil military leaders over the past 20 years, I think it's not trust that's enduring, that's institutionalized, and that cannot be reversed. I think right now they're trying to see at what point will the civilian leadership fail, and at what point would the larger political establishment ask the military as an institution to officially step in and take over decision making. I think that would be disastrous if we ever reach that point. I think the last time we had a similar crisis like that was probably under Gus Dur, so that's almost two decades ago. So we would essentially go back to even questioning if and when the military should play a larger formal political role and governing. So I do believe it's a high stakes game. It may not be discussed a lot, but I think at the local level and at the national level, I think the military is watching to what extent will the civilian institutions and the civilian leaders can actually step up.
I want to go now to Roland in the hopes that he will give us a little bit more of a reason to be optimistic, because I think, while there's a consensus that the public health response and perhaps the role of the military are causes for concern about Indonesia's direction, at least on the macro level, the economic response appears to have been pretty robust, creative, innovative, taking lessons from past crises. Yeah, Roland, can you walk us through some of the measures that the Ministry of Finance and Bank Indonesia, the central bank, have taken in response to the crisis? And do you think that that's enough, or do you think that they could be doing more?
Yeah, thanks, Aaron. Well, I don't want to disappoint you in providing a source of optimism. I mean, I think it is true that at the macro policy level, the policymakers have done quite a fair bit. But I guess if you want to ask how good has it been, I guess it depends on what your reference point actually is. I think if you take into account the quite significant constraints, particularly the financing constraints that the economic policymakers have been facing, then I think it is fair to say that they have done quite a fair bit. They could do a bit more, but I think they have done a reasonable job. On the other hand, if you sort of compare it to what you might argue is needed, I think then things start to look much more negative. So needed in terms of the optimal policy response to limit the downturn, the economic downturn, to being no deeper than it needs to be. Needed in terms of being able to provide the kind of financial support that you need to provide in order to enable the stronger public health response that I think many people would say is needed. I mean, after all, if you're going to shut down the economy for public health reasons and implement a lockdown and strict social distancing restrictions, then you need to be able to provide financial support to people, to households, to businesses, to the financial system to keep not only the economy, but arguably society afloat through the pandemic. And then finally, also, you might ask whether or not enough has been done in order to lay the foundation for a reasonably decent recovery, economic recovery out the other end. I mean, obviously, all countries are going to struggle in recovering from the COVID-19 shock, but whether or not Indonesia has done enough would be the question in order to at least be among the better performers coming out the other end. And my argument would be that at this point, they haven't been able to do enough, and there's reasons for that. But just to expand on that point a little bit further, I mean, what they have done is primarily on the fiscal side. Monetary policy doesn't have, in a direct sense, a huge role to play. And what they have done is this COVID-19 fiscal response package, which is roughly about 4% of Indonesia's GDP. You know, a slice of that, the biggest slice is probably going on social protection measures, which is a good thing. Another chunk is going on to support micro and small and medium enterprises, which is also reasonable. Another chunk to the state-owned enterprises, which some people might raise an eyebrow over, but I think actually in the current crisis is a reasonable maneuver. And then they cut corporate income taxes as well. I think taxes need to be going in the other direction in general, but that's a measure, and it's, you know, it has its pluses and minuses. And then of course, increased health spending. So overall, I mean, I think broadly that's a reasonable package of measures that they've targeted. One can quibble around the edges around each of those things, but broadly that's a reasonable package. The main issue is that at 4% of GDP, this is still one of the smallest COVID-19 fiscal response packages in the major emerging Asian economies. Last time I checked, only the Philippines really is doing less at about 3% of GDP. India wasn't doing much at first. Now they've ramped that up to about 6% of GDP in fiscal and quasi-fiscal measures. And then if you look at Thailand, Singapore, Malaysia, and certainly more advanced economies, they're all doing 10% of GDP or more. Now, I mean, some countries like Malaysia, you might argue, have possibly gone too far. But the overall point is that Indonesia's amount probably looks too small in order to both cushion the blow to the economy in the short term, but also prevent longer term damage from settling in. It's better than nothing, of course, and it's reasonably substantial in the Indonesian context, but it's probably not going to be enough. So the question then is, you know, why haven't they been able to do more? And for me, the really central problem is the financing constraint. So, you know, we all know that if we look back to March this year, when COVID-19 really became a global, not only health, but economic threat, there was a massive and quite violent exodus of international capital from emerging markets worldwide, around $100 billion removed over the course of 3 to 4 weeks. Indonesia was a big component of that, particularly within Asia. About $10 billion removed from Indonesian capital markets, primarily during the month of March. The currency, the thing that everyone always worries about, dropping by almost 20% at one point. So if you go back to March, April, things were looking pretty dicey, pretty shaky for the Indonesian economy. Since then, things have eased quite significantly, in particular due to the US Federal Reserve really pumping in a lot of emergency liquidity into their own system, but also extending some emergency liquidity lines to a range of other economies, which broadly adds to the global liquidity picture. So the capital outflows have basically stopped for now. But now the problem is that the inflows haven't really returned. And Indonesia is a little bit unique within the emerging Asia scene because they are reliant on those foreign capital inflows in order to not only finance the current account deficit in a macro sense, but in particular in order to finance the budget deficit, right? So now they're trying to target a fiscal deficit of about 6% of GDP. They've taken the smart move of easing their own budget deficit rule of 3% of GDP limit. They've gone from 2% now as the target to 6% of GDP as the budget deficit target for this year. I think that's broadly appropriate. The question is, where are they going to get the financing in order to do this? If the foreign inflows don't return. And this is where they have gotten creative. And I think, you know, they've taken a sort of unorthodox move and asked Bank Indonesia to to basically step in as a lender of last resort, so to speak, in terms of financing the government budget deficit. It is a significant move. I mean, we know that, of course, in the advanced economies, they're all doing a lot of this kind of thing, basically, in a sense, printing money. And one way or another, this indirectly finances the budget deficit. But the difference here is that not many emerging economies tend to do this. And Indonesia is actually, although a number of emerging economies right now are doing more of this kind of bond buying programs, Indonesia is much more in front, both in terms of the scale of what it is doing, but also because the government has authorized Bank Indonesia to directly purchase government bonds in the primary market. So normally they can buy it in the secondary market after someone else has bought it and then they're trying to on-sell it, that sort of thing. Now Bank Indonesia will be able to participate directly in the primary market. And so, and of course, this carries risks. I mean, some people would worry about inflation. I don't think that's actually the risk. The main risk is that this just breaks with economic orthodoxy. So the main risk is that you end up with some sort of negative market reaction at some point that would lead to renewed capital outflows and renewed problems. We haven't seen that yet. In fact, the market reaction has been reasonably, you might even say, at least neutral, maybe positive. That could be because they recognize that this kind of thing is actually a good thing. It's going to help the economy to recover, and actually the risks are reasonably muted. But also it could just be that actually at this point, Bank Indonesia is, you know, while they've stepped out of their comfort zone, they're still being reasonably cautious. And so far what they said they're going to do is fund about $8 billion is the amount they've set aside for this year, which is about 0.8% of GDP. So very, very small. Compare that to 15 to 20% expected in the major advanced economies. So possibly why the market hasn't reacted negatively to this, which is good, is because it's still quite modest. So the question is whether or not it will be able to stay modest while allowing the government to actually run that budget deficit that they minimally need to be able to achieve. At least they need to be able to deliver what they've set out to do, which is the 6% of GDP budget deficit. But you can see many reasons why, in fact, the financing shortfall might be much larger than they're currently expecting. And then the question will be, does Bank Indonesia step up and do more, which would carry risks? Or alternatively, does the government end up having to withdraw fiscal support from an already depressed economy, which would also carry very significant costs? So I'll leave it there, but we can delve into other issues.
You know, I think this is a very heterodox panel, and I think it's good because this is a crisis that touches all aspects of government policy and society. But one thread that kind of combines the three areas that you all look at is something that was happening in the background before COVID-19 struck that I think a lot of folks who don't focus on Indonesia specifically might not have caught on to. And that was this massive labor reform that Jokowi was seeking to do prior to COVID-19 hitting. And now he says that the discussions on, you know, the key aspects of that labor reform have been suspended. But I think, you know, part of this partly explains some of the response of the military and the security forces in terms of their reluctance to provide information, some of the crackdowns that have taken place on critics of the government, because they were worried that these reforms might spark some kind of social unrest and that could give rise to, you know, broader unrest as the pandemic spread. But I mean, that would be one way that the government could attract additional foreign investment, right? Is to make some of these reforms, make Indonesia a more attractive destination for investment. Are there other ways that the Indonesia can seek to finance the deficit that it's going to have to run in order to respond to COVID-19? Do you think that these reforms are sort of the only way that it could find its way back to fiscal health?
Well, I think, you know, I would distinguish between the kind of financing that they need right now. There is a slight distinction, which is they need budget deficit financing. That's actually the portfolio inflows that normally people talk about being less desirable because they're more volatile, right? Which, as we're seeing right now, is the case. Whereas the structural reforms that you're talking about really are about attracting more FDI into the economy, which wouldn't really go directly to the budget deficit question. I mean, indirectly, there would be benefits because that's foreign exchange. It would give Bank Indonesia a lot more room to maneuver. But at the end of the day, also, I think these structural reforms, I think that if Jokowi and the government is able to push through with the omnibus bill, and I know the labour reforms have basically been set aside, but they're still looking to proceed with the FDI rule changes as well as the business licensing changes. If they are able to go with that, you would expect it would give some confidence over the long-term trajectory of the economy, but I wouldn't see that as being anything near a silver bullet for enabling the recovery. At the end of the day, those sorts of measures, the benefits flow over the long term, but in the meantime, you've got a very acute, short-term, immediate problem. You need to provide financial support, probably right now is a better way of putting it, but very soon, one way or another, you need to also start turning to stimulus in order to get the economy moving again. What are the options? Well, I mean, private markets, that's out of their hands. They have to maintain confidence. So, you know, if investors see that the virus is getting out of hand, there's no pattern of investors globally reacting negatively too much to what happens with the virus itself, but you have to imagine that at some point they do. So maintaining confidence on that front is very central. You know, I've been advocating that international partners should be looking to do more for countries like Indonesia. Indonesia is exactly the kind of country that the international community should be able to support. Good economic fundamentals facing a largely exogenous economic shock, facing liquidity problems, but basically that hasn't happened. It doesn't really seem to be on the cards either, unfortunately.
Yeah. Elina, you know, obviously the government needs money to be able to fight the virus. And so you all have, you know, occasionally expressed some understanding of the government's focus on economic measures, but argue that the response to the virus, you know, has to come first. And I've noticed in some of the commentary that's come out of COVID-19 that you all argue that some places are doing this better than others, that they understand this connection, this linkage between the two, and the fact that public health has to come first better than other places and better than the central government. Are there bright spots in terms of local government administration, local governments that have handled this better than in other places?
Yes, and there are some areas that I would like to point out. And, you know, Indonesia is very, from province to province and even city to city, they're at very different milestone in the pandemic. Some of them are just starting, and some others we don't see a lot of community transmission, and some of them, you know, they're starting to get really hit hard. And so the approach to the solution does need to be localized. And in that regard, you know, we've seen some bright spots. So among others, you know, kind of in Bali and in some cities in Central Java, for example, in Kudus, in Demak, what we've seen is community getting together and working together to beef up compliance to the stay-at-home rules. And they're really checking visitors, and they're taking temperatures. They're making sure that hand washing units are ubiquitously available. So it's, I would say it's more the credit to the local communities and the neighborhood leaders, more so than, you know, kind of whoever is governor or the mayor of the area. But we've seen communities really getting together in Bali, in Central Java, and in West Java, for example. It's been kind of it's been the governor listening to the data and the advice of experts. Among others, you know, they've done direct procurement of test kits and PCR machines without the central government. So they are. It is so far the only province that have deployed mobile testing unit in large scale. From what I understand, it's 672 units. And it comes from the understanding that they have limited health capacity at the hospitals. So they need to tackle this head on before it got too big. And I think kind of West Java is in a good place right now. Some cities more so than others, because some of the cities still interact a lot with people from kind of commuters from Jakarta, for example. But they're in a good place right now because they make their policy based on data. And then there is West Sumatra and Lombok, for example. So these are, to the best of our knowledge, these are the two provinces that require swab test for every arriving passengers. So it doesn't matter if you've been rapid tested in other cities or other airports, you arrive, if you don't have a swab test result, you get swabbed again. And in a number of cases, they have found more positive cases that way. And not only requiring swab test, they're also using very low-tech solution. They're using the loudspeaker in mosques as an educational tool to reach the non-urban mass that don't have a smartphone. They use the local TVRI, the public broadcast network as an educational tool. And that's been a low-tech, low-cost, highly effective tools for education. And yeah, West Sumatra and Lombok.
I have one more question before we open it up to the floor. And I just remind people to keep your questions in the text box, really brief, just 3 or 4 lines. And then I will call on you to expand upon that question a little bit. But before we do that, I just want to go to Evan one last time, because when you look at what some of these local leaders are doing, the way that President Jokowi became prominent in Indonesia was by positioning himself as a can-do, capable, efficient mayor of Solo first and then governor of Jakarta. And when you look at some of the really successful local leaders, Ridwan Kamil, the governor of West Java, and then, arguably, although this is controversial, the governor of Jakarta, Anies Baswedan, who took a much more aggressive stance on the pandemic much earlier than President Jokowi did. How do you think that this plays out as people begin to think about the 2024 presidential election, when Jokowi is term limited, can't run for a 3rd term, at least as at present under the Constitution? Do you think some of these local leaders are going to benefit from having taken a more aggressive stance on the virus early on?
Yeah, I think for sure it's hard to separate the performance of local leaders from those who are genuinely listening to the data and doing as much as they can versus those who people in Jakarta might be seeing as just trying to get a stage in the run-up to 2024. I think a part of the problems in the beginnings of, let's say, February, March, all the way down to April and May between the central and local governments is precisely that. Some in Jakarta sees giving away information and giving autonomy to the local leaders to do their own testing, to issue their own data and all that has a political benefit to them and a political loss to Jakarta. The people at the regions think, well, we're the one who's dealing with the key problems. We need much more better information, and we cannot do it if everything we do, we have to wait for a decision from Jakarta, whether it's test results or everything else. So I think the acrimonious relationship between Jakarta and the local leaders in March up until May, I think, is one of the reasons why we see such a problem in terms of implementing the large-scale social distancing, the debate over do we have localized quarantines, do we have national quarantines, and I think it is a problem. But regardless of the problem in the past 2 or 3 months, I think it is absolutely the case that if we are looking towards 2024, I think at the very least, those who would be serious contenders for either the president or the vice presidency, I think would have to come from the local leaders, which means in a way it's good because then the Indonesian people have a way to measure your performance as a VP candidate or as a presidential candidate. If you were running as a governor or as a former mayor, did you do well enough at your respective locales that maybe there's less fatalities and all that. So I think in a way, I think this COVID-19 does provide a serious test case for those with aspirations for higher office.
There's a similar question I noticed from Dan Montgomery Hunt. I'm going to try, there's a little bit of a new system for me. I'm going to try to unmute your microphone. Let's see here. My apologies for the delay. If you could just use the raise hand function that should be at the bottom of your screen, I can then turn your microphone on. Got it. Go ahead.
Thanks, Aaron. Thanks, everybody. Really interesting set of presentations from panelists. Very good to hear them. I think Evan's actually just answered my question in terms of the long-term political fallout from how the government and how Jokowi himself is seen to have handled the crisis versus local leaders. I thought your point was very interesting about some of the, so Anes Baswedan and Ridwan Kamil, for example, jumping on this particular bandwagon to get more national profile. There's advantages and disadvantages with that, of course, for them. It only works, for example, in Ridwan's case, where his government is doing quite well. I think the East Java case study is more interesting in terms of tensions between local leaders, the mayor of Surabaya and the governor there in terms of what is the best approach. But really interesting to hear your ideas about how this may play out all the way to 2024. And I hope that the electorate in Indonesia does keep this in mind when they're looking at their candidates and their choices. But thanks. That's all from me.
Evan, did you want to add anything on that?
Yeah, I think just quickly, just because a lot of the local leaders have aspirations doesn't mean they'll actually be able to offer something to the political parties come 2023 or maybe even earlier. Ridwan Kamil is in a particularly good spot politically because, as Elina said, he's been doing well in West Java, but also West Java is the largest single electoral block in the country. So if he can, quote unquote, bring West Java with him at the table for the 2023 election, I think some candidates will have more leverage with the parties than others. And not all of them will be related to the performance in terms of handling COVID-19. I mean, you may do well in a small town in East Java, but that doesn't make you an automatic contender for the VP, right? So I think it has to be both. It has to be some sort of political leverage that you bring to the table, as well as your performance in managing the COVID-19 in your respective areas.
Why don't we go to Alex or Fianto? Alex, if you can, I'm going to turn your microphone on now. Alex is from RSIS. Go ahead. You have to confirm that you want to unmute.
Okay. Can you hear me?
Yeah, thanks, Alex.
Okay.
Go ahead.
Hi, this is Alex Fianto from RSIS. My question for the panelists is that there are some people who thought that the new normal policy that the Jokowi administration is currently implementing is basically has a lot of similarities with the so-called herd immunity adopted by, say, Sweden. If only that, of course, the administration doesn't want to say it out loud. How do you think about this assessment, and do you agree with it or not? And lastly, what would be the implication for other countries in the region, say Singapore or Malaysia, who have adopted a far more stricter mitigation policy against COVID-19? If Indonesia turns out adopting policy that's in many ways similar to herd immunity. Thank you.
Elina, I think that's definitely a question for you.
Okay, and I'm no health expert. I do communication for a living, and but I'll attempt to answer it. I don't believe any country is is applying a herd immunity strategy. So the quickest way to get herd immunity is to not do any intervention, get as many people infected as quickly as possible so you can get into that herd immunity as soon as possible. And no country, to the best of my knowledge, is doing that. Not Indonesia, not even Brazil and Iran and other countries that are very badly affected. So So in that sense, kind of if we are doing a herd immunity strategy for Indonesia, the goal will be to have 200 million people infected as soon as possible, and at a fatality rate of 3%, that means 6 million people would die. And I don't think any government wants to see this. So the problem is, where do we find that equilibrium between health and economy? And I'm not a health economist that can find this equilibrium. But if we look on the ground, we should just look around and see, kind of, are people ready? Are public facilities ready for reopening? In the absence of, kind of mass testing, mass tracing, and with limited healthcare facility, the best thing we can do is educating people to the death, pardon the pun, educating people really heavily about, you do not leave the house without a mask, and you have to put it on and put it off correctly. And then kind of redesigning public facilities to allow for social distancing. And this includes mass transport systems. And also allowing kind of, making hand washing units ubiquitous. So it comes down to three things, three simple things. And let's just look around us, look at city to city. Are they ready? Are this infrastructure in place? Are people educated enough to always wear their mask correctly when they go out? And this doesn't seem to be the case. And I'm based in Singapore, and in Singapore, I go out and I don't see a single person not wearing a mask. Is this the case in Jakarta, in Surabaya, in Semarang, or Bandung, or Medan? And from the number of reports that have been coming our way, that doesn't seem to be the case.
Aaron, can I jump with a comment on this?
Yeah, absolutely.
Now, I mean, I think from an economic perspective, I mean, to one extent, in one sense, what Elina is saying is very much correct, that health and having the virus under control, at least, and economic recovery, in a sense, have to go hand in hand. So if you prematurely ease the restrictions and the virus is still out there, out of control, then of course, people will be fearful for their health. They won't go out and do things. But people will also be more cautious, businesses as well, because there'll be a huge amount of economic uncertainty on top of that.
That's right.
So you'd worry there'd be a health disaster, but you'd also worry that there'll be renewed social distancing restrictions and lockdowns coming in place. The biggest risk is that if you do go down that path of having to put in place renewed tightening of restrictions, then you're doing it on top of, sure, a health situation, which is now worse, but also a economic situation, which is already severely damaged. And so you've, in a sense, wasted a lot of time, the earlier time spent bringing down the caseload. Having said that, I want to disagree a little bit or challenge people who are saying that the health side needs to come first, in a sense, because I think it is a lot more complicated than that, in the sense that, particularly for a country like Indonesia, they can't finance the financial support that's needed to people that are going to be destitute, some of them, millions of them in the case of Indonesia, households that might be better off but still have their savings destroyed, for example, and lose formal employment, and businesses that will go bankrupt. And depending on how far one goes with the lockdowns, of course, the financial system could even be at serious risk. So without solving the financing problem, it's hard to see how you can actually sustain a lockdown for long enough. And the final point I just add is that I think in a lot of these instances, and again, I'm no public health expert either, but the lockdown's purpose is really aimed at buying you time so that you can get your testing, tracking, tracing capabilities up, that you can get your intensive care capacity up as well, in order to be able to sort of safely reopen and not have your health system overwhelmed. But then the question is whether or not, in a situation where the government has very limited institutional capacity, whether or not that really is a realistic expectation. I mean, look at a country like India, for example. Lots of things that they have done. They did do fairly stringent lockdowns. They didn't provide very much support. Now they're starting to provide more financial support. They bungled it in a variety of other ways, but they did do the lockdown. they're now opening up because they basically couldn't sustain that lockdown for those same reasons, for those reasons I've said. Case loads are going up very rapidly, and as far as I understand it, they have done a reasonably good job on the health side, trying to really increase their capacity in a big way. Yet the expectations are still that they're going to be overwhelmed by July. So I'm not proposing an answer there, but I am suggesting that it is quite complex, and I haven't really heard a good answer, I think, from anyone really, not on the panel, of course, but more generally to this very complex question.
Roland, do you want to just take the question that's similar, that just came in from a student at Airlangga University in Surabaya on the new normal? I mean, is the new normal an implicit acknowledgement that the Indonesian government is unable or unwilling to provide adequate economic assistance for Indonesians?
I mean, my reading of it is, I can't speak to motives, but I think there is a structural constraint there that must be shaping the policy decisions that are being made. Now, my preference actually is, I think, they haven't actually flowed a lot of this money, that the 4% of GDP that I mentioned, a lot of it hasn't flowed yet. So it's still to come. Theoretically, my sense is they could go for longer if that was the judgment that they wanted to do. As I mentioned to you, Aaron, we have myself and another colleague have a paper coming out soon looking at what more Bank Indonesia should be doing. I think they could be going further than what they've been looking to do. It's not, the reason they don't want to do it is because they are breaking with the economic orthodoxy, particularly for emerging economies. That's obviously a very risky maneuver to be doing. There are a lot of risks around that, and no one can give them an answer that this will be 100% okay. But my sense is there are ways of doing it that would limit the risk of capital outflows, that would allow them to provide more financing support to the government. Basically, they'd provide financing to the government at quote unquote normal sovereign borrowing costs, so outside of COVID times, so to speak. So it would still be anchored against what the market would otherwise be providing. I think they could do something like that. That would give them more room to play. I think that eventually they're still going to face constraints, and I don't know whether the equation would stack up that they could go for something like what the advanced economies have done, of severe sharp lockdowns sustained for quite some time.
Why don't we stay with this economic theme? There's another question from Alia Freza from the World Bank. I'm going to turn your mic on now because there's some economic language in here that I think you will have to translate for the rest of us generalists. But why don't we stick with this economic theme for now? Your mic. You have to confirm that you want to unmute. Okay, I think that's not working, but you can see that in the text box, there's the question there, basically asking you to, could Bank Indonesia push this too far? Could this asset purchase program go too far? Roland, do you want to take that on, since that is, you're specifically advocating more aggressive measures on the part of Bank Indonesia? Yeah,
I mean, I can see Alif's question, which is about whether or not specifically, but I think you raise a broader question, but whether or not the asset purchase program would end up buying up a large proportion of the bonds that are out there in terms of the supply, and what the consequences of that would be. I would say that the consequences of that is that you would eventually lose the market signal as to what the correct rate should be. I think that requires a lot of bond purchases from Bank Indonesia, so they're really far away from being at that point. Even if there was potentially some loss there, I'd say it's a trade-off. You lose a market signal temporarily, but you do that so in order to be able to finance the budget deficit that you need to survive a crisis. But I also think, as I said, my preferred approach would be that they aim to anchor yields around the quote-unquote normal market rates. Therefore, they actually would be preserving the market signal in any case. Could it go too far? Of course it could go too far, but I think this is the real question, because those that do worry about quantitative easing, printing money, and these kinds of things leading to currency debasement and crisis, it's kind of a slippery slope argument, right? Doing it once is not that big a deal. Doing it temporarily is not that big a deal. The question is whether or not people, or in this case, the market, believe you, that you will stop printing money and stop running massive budget deficits. That's the real question. So you can go too far, but this is the whole point here. This is supposed to be temporary. If the Indonesians can convince everyone that it is temporary, then they've got a lot more room to maneuver.
Elina, before we went into that conversation about the economy, there's a question here from Andrew Au about spending on PPE and also on vaccine purchases. I mean, what have you seen from the government in terms of the COVID stimulus or some of the money that's been redirected? Because I know at the beginning of the outbreak, there were real shortages, really sort of extraordinary compared to some of Indonesia's peers in the developing world or in Southeast Asia of PPE. So, you know, how has that been resolved, and what prospect is there of you know, solving these issues in terms of Indonesia is, you know, probably in the next year or so going to need to be buying hundreds of millions of people vaccines?
Okay, I'm still muted. Okay, there you go. I'm not muted. So we'll go back in time a little bit to the start of the when Indonesia started being hit in early March. At that time, the world is focusing on Italy, Iran, Germany, and cases were starting to go up in the U.S. So, and in March, you know, kind of the growth of cases in Indonesia was very slow. So and there was worldwide shortage of PPE. So every country is fighting for this limited supply of PPE and test kits and ventilators and what have you. And so kind of, you know, when you have so much demand and limited supply, who do you give it to? And then, you know, of course, you give it to countries that are really struggling because of huge number of cases. So Indonesia at that time with only hundreds of cases, you know, we didn't count, you know, we're not on anybody's radar. But even then, you know, we knew that, you know, if we were going to be hit, we're going to be hit in a significant way. So what proportion of the budget is going to health capex? From what I understand, about 400 trillion rupiah is going into COVID response, and but less than half of that is going to health response by way of, you know, kind of purchasing all these facilities, and as well for bansos, kind of basically safety net programs. And to top that up, every provincial government and every municipality is supposed to set aside a portion of their budget for testing and treatment as well. So we don't know the lump sum figure of that, but what we know is that the central government is setting aside close to 200 trillion for it, and I'm not sure how much of that has been disbursed.
Got it. Evan, there were some high-profile donations of PPE at the beginning of the outbreak, I think in mid-March, from China. There's been a lot of speculation in the world that you and I inhabit most of the time, the sort of the foreign policy world, about how effective China's mask diplomacy has been. How did this, you know, very public handover ceremony at Soekarno-Hatta Airport of masks and PPE to Indonesia, how did that play in Indonesia? Did it make China appear to be more of a player, more of an important partner for Indonesia in the future, given that it was able to provide this aid? And the other country that's really played a really big role in Indonesia's response has been Korea. And I think this has gone under the radar outside of Indonesia and maybe East Asia more broadly, but the reagents that are needed for the testing kits have mostly come from Korea. And I think that's where Ridwan Kamil got some of his supplies, right? So has Korea benefited from being able to play that kind of role?
Well, I think there's two different issues there. One is the realm of public perception with regards to the COVID support, and two is more the I guess in a way the vulnerability of our supply chain, as well as our economic growth vulnerability to China. I think the COVID-19 hammers home that point about how vulnerable we are in terms of our supply chain to China. And if you look at the list of the task force approved companies providing medical supplies, PPEs, medicine, test kits, and all that, I think I saw something like about, let's say, between 30 to 50 companies on that official list. I think more than half or close to 80% are linked to Chinese companies. So a lot of the local companies are also buying their stuff from Chinese companies as well. So I think as far as foreign policy concerned, I think it's tilting Indonesia a lot more closer to China in terms of vulnerability. The public perception doesn't seem to matter much. I think, for one thing, a lot of the focus of the public right now is just basically on surviving. They have less time worrying about which country looks good or bad. I think the government is struggling to control the narrative. So the issue of external support and all that isn't particularly blown up in the local press. Sure, there's some news clippings here and there, but it's never made into a big deal. So I think if there are concerns about the effectiveness of China's mass diplomacy, it hasn't fully surfaced at the PR level yet. But in terms of the vulnerability of medical supply chain, I think that's particularly clear now, that even both private businesses and government companies and ministries and agency, for the most part, they rely on rapid tests and all that. About 90% are provided from Chinese-linked companies. And this goes back to your earlier question about how was it possible that in the midst of the pandemic, that the defense minister and other big high-profile individuals have to come and welcome the supplies. It's because the local companies who facilitated those assistance or those purchases are actually very close to the political elite here. So it's less about China, the country, and it's more about understanding, I think, the domestic political economic dynamics with regards to the procurement aspects and companies.
Just talking about the public perception earlier, you said people don't really have time to focus on, whether China is good or bad, Korea is good or bad. They're just trying to survive. But we did see last week in Burhanuddin Muhtadi's poll. Vinny, I think you've turned on your video. There you go. We did see last week in the Indikator poll that Indonesians, there's been a sudden slump in support for democracy, even as the approval of Jokowi, even as the approval of the government's response to COVID has fallen by about 15 percentage points. Jokowi's approval ratings have remained relatively stable. They haven't fallen by that much. But support for democracy, there was an unprecedented fall in support for democracy. What do you think is behind that shift in support for democracy? Because that seems to have been the biggest casualty in terms of public support as a result of the pandemic.
I think in a weird electoral psychology way, Jokowi is separate from the government, both at the national and local level. So approval of Jokowi is more of him as a person. Is he a good guy? Did he try his earnest to fix things? That part is why you see the numbers stable for him personally, but it doesn't necessarily reflect approval with regards to the government's performance. And I think in the past 2-3 months, my hypothesis of why the number for democracy is sliding has to do with that part of the government performance in terms of delivering good, decisive central messages and policies to deal with the pandemic. That's one. Two, I think the infighting and the inconsistencies between the local and national government, I think creates the impression we're in this situation because democracy has made things messy. That local leaders have political ambitions, that central governments don't want to give away too much autonomy. So they're all mixed into that performance of the state to deliver to the public. So in the minds of the electorate, I think there's a conflation between democracy as a set of values and procedure versus state capacity and quality in terms of providing public goods, delivering good policies and all that, and with the popularity of the head of the government. These three things, I think, are different. But as far as the support for democracy, I think it's still tied with the performance of the state and less about the performance of Jokowi as a person. I think for some magical reason, the public is very forgiving in terms of Jokowi himself as a president.
Yeah, it's fascinating, the political psychology of that. What I think this is a good opportunity to segue into a question from Crispin Coates in the UK. So I'm going to try to turn his mic on. See if I can. Crispin, you should be.
Sure, on my question from earlier, and it touches upon, somebody made the comment about the new normal. We've obviously seen the military expand into a number of roles as a result of this crisis. Under what circumstances will you see the military step back? Or are we now, as part of the new normal, going to see a little bit of an institutionalization of the military in these new roles? Thank you.
Thank you. That's a very good question. I think first on the new normal, I think missing, from the debate about health versus economy is obviously the political calculation of the elite in Jakarta, right? For them, it isn't about health or the economy. It's about which part is good or bad politically for the government, and as we head to 2024. So in some ways, the new normal is about 2024. Unfortunately, for some in Jakarta, I think Jokowi is pretty much a lame duck president. That all that matters now is who can run for 2024. So how fast you can implement the new normal depends on whether or not you're running for 2024, and to what extent I think you risk on having local unrest that could escalate further in your respective locales. I think that the potential for domestic unrest and even wider violence and riots is something that's been discussed in the last few months beyond just the economy of the health. And how that relates to the military, I think is important, because if the new normal is about maintaining sufficient control of the domestic political and social economic scene that's stable, that prevents unrest, that prevents any ripples of dissent or even criticism, I think, yes, I think the state will deploy more of the security forces to sustain that new normal up until the election, because nobody wants to have an election in the midst of a local unrest that could escalate into something further, and even perhaps in terms of the scale, like the Asian financial crisis in 96, 97, right? So I think in that sense, the use of the security forces, both military and police, to not only deal with the pandemic, but also to sustain domestic stability, I think will be part of the new normal for at least a year or two. But the first test, I think we will see whether or not we will have successful local elections at the end of this year. I think they've decided to let it happen. So we'll see. We'll see how a strong electoral dynamic, will it change the new normal into something bad or better. But yeah, I think the role of the security forces, I think, will likely to be the same for the next 2-3 years.
It's been really interesting to watch. Last year, I think if we were having this at this time last year, we would have said that Jokowi probably saw the police force as the really key political ally between the military and the police, the armed forces and the police in Indonesia. And that seems to have shifted a little bit with the pandemic, with the military taking on a much more prominent role. Do you think that they are now back in the front seat in terms of being seen as a really important institution that Jokowi relies upon? Is there a police-military rivalry emerging out of the pandemic response, and how are the police responding to that?
I think when it comes to the role of the police, I think it's not just about institutional reform of the police as an organization, but I think it's a wider legal reform that is required to deal with some of these issues. You know, the police rely on pre-existing laws that should be abolished, because it can be easily misused to silent critics, for example. So as long as those laws exist, the potential for abuses can still happen. The second issue I think you raise about the relationship between the police and the military. And I think the problem precedes pandemic. I don't want to say acrimonious relationship, but I think at times the police and the military seem to be engaged at the very least in some sort of bureaucratic rivalry. And this has going back to 99 when the police was first separated from the armed forces. So it's been an ongoing problem. But so far, whatever solution that the president has had to manage the relationship between the police and the military has been ad hoc and more reliant on the personal approaches of the president, rather than having an institutionalized solution to managing the relationship between the police and the military, mainly because the military is still allowed a domestic and internal security role under its current law. So I think as long as that happens, I think there will always be structural incentives for some sort of rivalry between the police and the military. I think the election, though, in 2019, during the campaign, I think Jokowi realized that he couldn't ignore the military too far. I think he tried to provide more for the military's corporate interests during the campaign and over the past 6 months or so. So I think if there's a tilt in the balance between the military and the police from the president's side, I think it's a little bit more on the military at this point. But that doesn't mean that the police is going away as a domestic actor. I think right now the president is playing a very shaky a game of balance between the police and the military. In the pandemic, I think it's a little bit of both, because the military doesn't have the resources to be deployed full time. The police has, but some parts of the country require more of a military presence than the police presence. So I think right now they're trying to see if the pandemic can be a way in which both institutions can play a somewhat equal role. And at the local level, it's actually quite balanced. At the local level, the police and the military are involved in the local task force, almost about 50-50. At the national level, I think in terms of decision making, also about maybe 5-45. So in some sense, I think Jokowi is trying to make both happy and not just ignore one at the expense of the other.
Yeah, if I could, I just mentioned, I think really some of the unsung heroes of Indonesia's response to COVID-19 who haven't gotten nearly as much attention as they deserve are Indonesia's diplomats who, speaking with Kemlu yesterday, I learned that there have been 110,000 repatriations of Indonesians around the world, including 20,000 from cruise ships in 28 different countries, and 500,000 care packages delivered to Indonesians living overseas who are in lockdown situations and might not have been able to get out to get essential goods. And so it's interesting to me. We focus a lot, and the media in Indonesia focuses a lot on the military and the police and their response. But when you look at who's really helping warga negara Indonesia, the Indonesian citizens overseas, a lot of times Indonesian diplomats are right there, and they don't really get the attention that they deserve. We're coming up on the end of our time, so I just want to take one last question from Michael Taylor. I see your question, Decca, and I really would like to come to it because I think West Sumatra's response has been really interesting. But Michael's question's been up there for a while, and I'm afraid it's the only one we have time for. So, Michael, I'm going to you're now allowed to talk, and you should be unmuted. Do you want to ask your question?
Sure. Thanks, Aaron, and thanks for the opportunity to ask a question. This is I think for Roland. And as someone whose memories of Indonesia go back quite a way, when I see the news about Bank Indonesia intervening in its asset purchase program, it just strikes me whether there are parallels with its interventions 20 odd years ago to support the banking system and the liquidity support that flowed to the banking system then, and to what extent there is a possibility that Bank Indonesia's asset support program now could go to support well-connected insiders. How big a risk is that?
Yeah, thanks. I'm off mute. Yeah, I mean, I think it's a good question. I mean, I mean, in the first instance, I think the most central thing is probably what Bank Indonesia does to purchase bonds in the primary market and how it prices that and so on. And to the extent it's doing that, I think there's few risks of that being, being able to be used to benefit insiders. I find it difficult to see what the channel would be exactly for their intervention in the secondary market as well, given this would happen, on the exchange, on the bond market. So I'm not sure how that could flow through. But one channel, I suppose, which is what you might be worried about, is that you would then see all this liquidity enter the system and then some sort of capital flight that would then put the currency under enormous pressure, and with those parallels back to 20 years ago. I guess my response is that capital flight is always going to be possible. Indonesia is always going to be vulnerable to that. In this case, this would be a domestic capital flight, but also foreign capital flight, given all of the portfolio flows that have flowed into Indonesia over the years. But my answer to that, I suppose, is to come back to whether or not there's confidence in where the economy is going overall. It would take some sort of deep internal shock. And of course, that's not impossible when you've got something like COVID-19 roaming around. So I think it would take something like that really undermines confidence in the entire social and political system in order to cause that sort of capital flight to occur. And that's the reason why I think, although they have gone for this new normal, it's probably not herd immunity, because then you're really letting the virus just completely run loose. So I think, to me, that's how I see that. I'm not sure whether you're getting at something a bit different in terms of how insiders could benefit from an asset purchase scheme, but I don't quite see it myself.
Roland, can I just add on to that? There is this $8 billion bailout of Indonesia's state-owned enterprises. And one that we've talked about before is Garuda Indonesia, which has, I think, $2 billion in debts to pay this year, and is unlikely to derive that from revenue. And there's a connection here with Evan's topic, given how closely Garuda has always been linked to the security forces. I mean, do you think that some of that funding, which is not going to PPE or to purchasing vaccines, things like that, do you think some of that's driven by special interests seeking payment or seeking revenue, and ahead of people who really need it in Indonesia? Could that threaten the financial response?
I think that's a really good point, Aaron. I mean, to the extent there's going to be insiders benefiting, it's going to happen through what they do with the budget, I think, rather than what happens at Bank Indonesia, unless they have to dole out special liquidity loans directly to banks and that sort of thing. But that's another matter. I think there is an economic case, of course, for supporting the state-owned enterprises, because they are a source of formal employment. And if you seek to restructure them too drastically in this kind of environment, then really you're destroying formal jobs, you're depressing demand in a depressed economy, and it'll have cascading effects on the businesses and the financial system. Undoubtedly, and I'm not close enough to say what exactly is going on, but undoubtedly there's probably a degree of rent seeking and patronage going on in terms of how this is occurring. But even there, maybe I'm a little bit too easy on the policymakers, but I would sort of give them a pass in the sense that, when you're dealing with a crisis, your goal is to keep the economy, the society afloat. And part of that is keeping the current political system to an extent afloat. And that includes some of the warts and all elements as well. So I sort of am a little bit more sympathetic to that sort of thing, but I think there are genuine issues there, and there are a lot of people that care about good governance in Indonesia, rightly so, and they would rightly keep an eye on that sort of thing, how I would see it.
Elina, I want to give you the last word, and then we'll conclude. I mean, where do you see things going, based on everything we've discussed today, where do you see things going with government's response over the next few months? Do you think it will begin to adjust in some of the ways that you've recommended, or will it have to adjust in those ways? Or are we heading toward a new normal in which sort of a laissez-faire attitude to the spread of the virus?
We are continuing to advocate for kind of more urgency in in communicating the risk of the pandemic. I mean, when you see people going out en masse without mask, something breaks down in the communication for sure. What we have recently found out is that kind of suspected cases who are supposed to be quarantined at home, they don't know how to do proper quarantine at home, and probably because health facilities are so overwhelmed, they don't take the time to explain what home isolation or home quarantine means. And so what we have seen lately, especially in the case of East Java and Surabaya, is that the spread of COVID-19 has happened in the homes, which means one person who is not asymptomatic, and then basically they infect the rest of the household. And so currently what we are advocating is educate people on how to do proper home quarantine. And in cases where it is not possible for them to do it at home, if people live kind of in a 2-bedroom house and there's 8 people living in that household, 8 people, 3 generations, you shouldn't really be quarantined at home. You should quarantine in a government facility. And we have said all along, starting in early March, that you have to quickly separate the sick and the healthy, the positive cases from the rest of the family to stop the spread. And we will continue to do that. We are still advocating for risk communication and give it equal allocation on government press conferences. Currently, every afternoon during the press conferences, kind of positive news take up the most, kind of like the biggest block of time, and there's no proper risk communication happening there. And as a crisis communication practitioner, I cringe, kind of seeing this reality when the risk is still all around us, because testing is so low, tracing is so low. And I know that you mentioned Jakarta earlier. I was just looking at the tracing ratio. As of last week, their tracing ratio is only 4 something. So basically they've only, successfully kind of like identified 4 more people to be tested for every positive case. And as you know, kind of in countries that have brought this, this pandemic under control, their tracing rate is at the minimum 25 to 1. In Vietnam, it's even 600 to 1. For every positive case, they locate 600 other people. And in Indonesia, we're talking about 4 to 1, 5 to 1, 10 to 1. So we're still far ahead. We're still far behind kind of what we would call kind of like a desirable metrics to say that we can safely reopen. And to any businesses and anyone who's looking at going back to business as usual or the new normal, kind of, I would put a word of caution there that we are not ready, which means businesses do need to take more precautions than usual than in countries that where the data kind of like support reopening. And but yeah, I agree with Roland as well that kind of this is not a dichotomy. Health and economy goes together, but there needs to be a lot more risk communication than the government is currently doing.
It certainly seems like communications is an area where the government could improve, even if it doesn't have the resources to improve in all these other areas, like say Vietnam. But I think there's been a lot of, this has been a really, really useful conversation, really helpful. I've learned a lot, and I hope that all of our attendees have as well. We probably could have gone for another 30 minutes, but I think we covered a lot of ground. So I want to thank you all for your presentations and for bringing such insight and depth of knowledge of the issue to the discussion. And thank everyone, all of you who tuned in from around the world for this session. I hope you've enjoyed it, and we hope to do more of these in the future, focusing on other aspects of Southeast Asia's response to COVID, and then some of the things that have continued to go on in the background in addition to COVID-19. So thanks very much for tuning in, and thanks to all our panelists.